thank you very much for joining. Today is the second SHAP at 4, and we're trying to figure out how the project has been doing for the last four years. And we have amazing adolescents who have been not only beneficiaries, but also one way or another implementing the project hand to hand with the partners in different countries. So today we have Fatma Hussein, who's representing Access Medicine Platform from Kenya. We have Blessing Bwalia and Petronila Sampa, who are representing MedRap from Tanzania. And we do have Leticia Samson, who's going to join us on screen later on, representing ENASA from Tanzania. So thank you. I'm super excited that the project is for adolescent girls. And clearly, it's evident that adolescent girls are the ones who have been uh, benefiting from this project. So let's just talk about your feeling and how SHAP has been in the last couple of years for you. I mean, we're closing down. All good things have to come to an end. But Blessing, how has it been for you in the last couple of years?
Hi, Liz. Thank you so much. I hope you can hear me.
Loud and clear, yeah.
Being part of Sharp has really been an amazing experience. If I were to put it in one word, I don't think there's a word that has been created yet for that. So I'm yet to feed into the dictionary. Otherwise, I've gotten a chance to interact with policy, just not on a basic level, but then getting into those restricted offices that young people would often not find themselves getting into. Thank you.
Yeah, I hear you. There is no one word actually, and I totally appreciate that. But as we're talking about Sharp coming to a close, the beauty is inclusivity for this project. And we have Fatma from Kenya. Now, Fatma, we're talking about sexual reproductive health and where the Kenyan team is implementing, talking about sexual reproductive health in adolescent kids. It's not something that works every day. So how has the experience been for you?
The experience has been very good to me. This experience showed me that going to hospitals, I know I can get treated well,
Mhm.
really hard, and find medication.
Which is what we're talking about. For SHAP, we're trying to make sure that there's accessibility of sexual reproductive health services and commodities. And I appreciate the fact that now you know that you can actually walk into the clinic, into the hospital, and ask for SRHR services. But let's take it back a bit. We're talking about access, but we're also talking about inclusivity, right? The services and the commodities has to be for all adolescents. And we have Petronila from MedRap. Petronila, I hope you can hear us. How has it been, your experience, especially from a different front where the project itself has been working hand to hand with persons with disability, especially in Zambia. So what has been your experience altogether?
I think you can get me right.
Yes, loud and clear.
Okay. Yes. I think it's been very edifying. I think from the kick of the project, there was an issue of not including persons with disabilities for different reasons, cultural. Um, but as the project was running, we've seen a lot of improvement where persons with disabilities of different disabilities being included in their programs and also being heard. We've seen an improvement in how the structures have been made inclusive. We've seen facilities being inclusive, even healthcare providers changing their mindsets towards persons with disabilities. Also, we've also seen a great improvement when it comes to healthcare providers' reaction towards persons with disabilities. I think the more I would say it's been very edifying for persons with
Mhm.
disabilities because a number of them couldn't access services, but the push through the SHARP projects on the concept of access has been very adequate towards persons with disabilities. And we've seen a great improvement in terms of access to SRH services for persons with disabilities. So it's been a very good 4 years and we've seen very, very good insights from that.
And let's talk about that. I know the adolescents have been in the same rooms with policymakers, faith leaders, right? Where you're talking about
Yes.
working with human rights institutions. Is there any bold moment that you had to speak up in front of an authority figure or, somebody from the faith religion. And for you, it felt like, just because of this particular project, now at least I can open up and speak about sexual reproductive health to somebody who, in any other day, it would have never actually happened. Maybe Petronila, you can let us know if you've had that experience.
I think we, as a country, Zambia is a Christian nation, but we've had situations where we've sat down with religious or faith leaders where they've despised access to sexual reproductive health. So my understanding in SRH has been not only just access, but even getting information. With the rise in teenage pregnancy in the country and a lot of defilement cases, rape cases, the
Yeah.
ideal knowledge that we've accessed from the SHARP project of getting to know how to access these services, where to go in a situation where such things happen through the faith based, it has been very helpful. I've had a situation where a person, or maybe I would say a religious leader, was not in support of talking about it. But then through my approach, because I had to bring it out, I think his issue was, why should a person with a disability even go and access? Because why should they even be counting in such situation? But they're forgetting that I'm a human before my disability. And I
That
have
usually
feelings,
happens a
I
lot.
have needs.
Yeah, and
Yeah,
it tends to happen a lot. Sorry, Peter. That really tends to happen a lot. And I wanted to bring in Leticia because Leticia, the role that you play as a young advocate for sexual reproductive health and even youth voices has come out quite clearly in the different work that you do. I don't know whether Leticia, you can hear us because I can see you're muted, but maybe the team can actually also just chip in. If you are like the minister, it could be the minister for health or the minister for youth affairs, only for one day, right? So the SHARP project says, you know what, Blessing, Fatma, you guys have been nominated as the youth minister or the minister for health just for one day. What would you change first? Maybe let's start with Fatma. What would you change if we said, you know what, Fatma, now you're the minister for health? What would you change?
For me, I'll change for the part of girls are, we Muslim girls, we are very afraid for the sexual reproductive health. They're very embarrassed of saying, even to their parents. So for me, I'll make it that more open for girls to come speak up for their rights and be heard.
That's all we need, and that's what the project itself is all about. Also empowering girls to speak. And Blessing, you've been speaking on different platforms, yeah? You've been meeting actually the ministers of health. We saw that you were in Ghana recently, you're in Eswatini, also trying to push the agenda of sexual reproductive health. If you were a minister just for a day, 24 hours, what would be the first thing? Don't get greedy. Don't get greedy. Just one thing, Blessing.
One thing.
Yeah.
And this, every time I go into a meeting, they're always telling me, Blessing, do it in summary, because when I start talking, they think I'm not going to stop. But then the first thing I would do is change the budget. I love it when I see enough money where my needs are. I think I would change the budget allocation for the health, but not only changing it, I would also change the strategy that's being used to mobilize the resources that are directed towards the health sector. I think it's important that we also just go back into trying to seek for local resources. I had a conversation with some of the people from the Muslim society, and they were highlighting how we see churches collecting offering, we see them, and then we see buildings sprouting from these offerings. Why don't we do the same for health? We should not just depend on one source. So that is the first thing that I would do. I would want a lot of money to go there, but I would want it to also come from us.
Okay. I was going to stop you, but I now understand why they keep on saying summarized Blessing. Please give us the summarized version. But Petronila, in your case, let's just say maybe we upgraded you. So you have Fatma, the Minister of Finance, and you have Blessing, the Minister of Health, and you are the president of a country. So Petronila, what would be the first thing you change from your end?
I think I would ensure that more money towards because health and education are like the priority of a human being. Without health, there's no education. Without education, there's no health. So for me, I would ensure that in the Ministry of Health, I think it would be one of the ministries that would have the highest amount of money going towards it, because without healthy people, we wouldn't have doctors. I wouldn't be standing as president because I don't have a good health system. So I would ensure that all health systems, including especially for adolescents and young people, looking at my country having a high number of young people, I would ensure that adolescent health and young people's health is budgeted for at a higher rate than even other health services. Of course, they interlink, but I think that would be something I would really look into and ensure that work hand in hand with the Ministry of Health and the minister to ensure that whatever he's coming up with or she is coming up with is in line with what we agree. Not only after 2 years things fall apart, and ensure that
I know.
if we're going to link towards that, it has to be towards that. I
Has
think I would
been money,
I
money
would
all the
focus on
way.
that.
Money, money
Yes.
all the way. Okay, so Leticia, I don't know whether you can actually unmute yourself and maybe give us your thoughts around your experience also, and if you were heading a department. I don't know whether Leticia can hear us now.
Yes, I can hear you, but
Yeah.
my video, yeah.
No worries. No, I know. Technical glitches. We are always prepared for this, Leticia. No worries. But Leticia, if you were the first lady, yeah,
Okay.
your husband is the president of Tanzania. Okay, I'm not changing the government right now. I'm just saying if you were, what would be that one thing you'd change for your country?
Yes, I will. Let us manifest. I will surely. The first thing that I will change is allocation of budgeting on health sector, because I can see the lack of money. People, they are suffering, especially on the issue of SRH. My fellow adolescents, they face many challenges due to lack of funds, due to the shortage of allocated budget. So the first thing, it is allocation of budgeting in health sector, especially in SRH issues for adolescents, because at the mostly challenging, mostly group who are facing with challenges. So yes, that is the first.
Okay.
Yeah.
Well, ladies, I really do appreciate you for the 10 minutes we've been discussing about the project itself. And clearly, this was a sexual reproductive health project for the adolescent girl in the Great Lakes region. So we appreciate your time and appreciate your input. Thank you very much. And hashtag healthy adolescents, right?
Yes.
Great. Thank you and have a great afternoon.